I'm Cancer Rehab Specialist, Dr. Leslie Waltke. Today, from the tip jar, strategies to empower your patient to lower their lymphedema risk to as low and as minimal as possible. Here's the scenario. You are a physical therapist sitting in multidisciplinary cancer conference, and your cancer team is discussing the possible need for further axillary surgery and/or radiation for a patient who's had an ipsilateral regional recurrence of her breast cancer. So the cancer has come back in the same side axilla. One of the group's concerns, of course, is that any additional surgery or radiation will further increase the patient's risk for lymphedema. After much discussion, the plan is to recommend to the patient she undergo surgical removal of this recurrent cancer at her axilla, with possible radiation following depending on the surgical pathology. Then the medical oncologist turns to you, the PT, and says, the patient knows her risk of lymphedema is going to go up and she is not happy about it. What can you do proactively to help her? So now the entire multidisciplinary team is looking right at you. What is your answer? Your answer will be based off current evidence, which is the biggest modifiable risk factors for lymphedema are infection in the involved limb, gaining weight or being overweight, and poor musculoskeletal health of the involved quarter. So strategies then to minimize her risk will be, number one, to teach her infection risk reduction. 2, teach her surveillance for infection. 3, teach her an action plan if she notes something suspicious. 4, address her body mass index if needed. Then 5, get her to a PT post-operatively to maximize soft tissue mobility and soft tissue length, and to maximize the strength at the involved shoulder and arm. And finally, to get her on a regular exercise routine. So there's the evidence-based answer I would recommend. I'm Dr. Leslie Waltke. Thanks for joining me for this episode of The Tip Jar, empowering better care for our patients. Have a great rest of your day in the clinic. Care well for your patients and for yourself.